Have you ever thought, I'm doing everything right, I'm eating less, I'm on my GLP-1 medications, but my weight loss stalled? And then the question comes up, could it be my thyroid? Today, let's talk about thyroid. Thyroid issues are very common. They are usually misunderstood, and yes, your thyroid can absolutely impact weight loss. Hi, I'm Dr. Bazgha Khalid. I'm a board certified internal medicine and obesity medicine specialist. And in this video, I'll explain what the thyroid actually does, how it affects your metabolism, how thyroid dysfunction can stall weight loss, the connection between thyroid and GLP-1 medications like Wegovy and Zepbound, how common thyroid problems really are, what labs matter, signs to watch out for, myths versus facts, and questions you may want to ask your doctor. You can use video timestamps to jump to the section that interests you the most, and by the end of this video, you'll understand whether thyroid is likely part of your story or not. What is thyroid? Thyroid is a small butterfly shaped gland in front of your neck. It's small, but its impact is massive. Thyroid gland produces hormones, mainly T4 and T3. Thyroid hormones regulate metabolism, body weight, brain development, body temperature, heart rate, energy levels, digestion, bone and muscle health, menstrual cycles, and even mood. Think of your thyroid as your body's metabolic thermostat. When it works well, metabolism runs smoothly. When it slows down, everything slows down. And that's where weight changes can happen. Now, let's talk specifically about weight. How the thyroid affects weight. When thyroid hormone levels are low, a condition called hypothyroidism, metabolism slows down. Low thyroid or hypothyroidism can cause hair loss, fatigue, mood changes, memory changes, depression, high cholesterol, weight gain, dry skin and hair, brittle nails, cold intolerance, thyroid enlargement, slow heart rate, muscle weakness, sore muscles and joints, constipation, and menstrual changes. But here's something important. Most thyroid related weight gain is not dramatic fat gain. It's often water retention, reduced energy expenditure, and slower metabolic rate. Now imagine you are on a GLP-1 medication, your appetite is lower, you're eating less, but your metabolic rate is also lower due to thyroid deficiency. This can create a weight loss stall. Not because your GLP-1 medication isn't working, but because your metabolic thermostat is set lower due to thyroid dysfunction. Now, let's connect this directly to GLP-1 medications. GLP-1 medications like Ozempic, Wegovy, Mounjaro, and Zepbound primarily work on the brain to reduce appetite and increase satiety, on stomach to slow gastric emptying, and on pancreas to increase insulin and decrease glucagon. GLP-1 medications do not directly stimulate thyroid hormone production. So if someone has untreated hypothyroidism or low thyroid state, then GLP-1 medications can reduce food intake, but metabolic rate remains suppressed due to low thyroid state. This mismatch can slow weight loss progress. Now here's another layer. There has been discussion about GLP-1 medications and thyroid cancer risks, specifically medullary thyroid cancer, which I'll talk about briefly. But first, let's talk about how common thyroid dysfunction actually is. Thyroid dysfunction, especially hypothyroidism or low thyroid, is very common. In the US, around 12% of people develop thyroid disease in their lifetime. Women are 5 to 8 times more likely than men to have thyroid problems, and hypothyroidism or low thyroid is more common than hyperthyroidism or high thyroid. The most common cause of low thyroid is called Hashimoto's thyroiditis. This is an autoimmune condition that leads to thyroid hormone deficiency. Many cases of Hashimoto's thyroiditis are mild, some are subclinical. This means low thyroid state is present, but it is not yet severe enough to cause obvious or classic symptoms. And some cases of hypothyroidism may go undiagnosed for many years. Which brings us to symptoms of hypothyroidism or low thyroid state. You may want to look for fatigue, depression, memory decline, dry skin, constipation, irregular or heavy periods, muscle and joint pain, cold intolerance, weight gain, puffy face, and slow heart rate, to name a few. Now, here's the tricky part. Many of these symptoms overlap with calorie restriction, GLP-1 medication side effects, perimenopause, and chronic stress. So, symptoms alone aren't enough, which means labs matter. So, how do we check for thyroid function? Basic thyroid testing includes TSH, short form for thyroid stimulating hormone, free T4, sometimes free T3, and thyroid antibodies if autoimmune condition is suspected. TSH, which is a short form for thyroid stimulating hormone, is the most sensitive screening test for thyroid problems. When thyroid hormone is low, TSH rises. In low thyroid state called hypothyroidism, TSH is high while free T4 is low. Now, here's an important clinical point. Not every mildly elevated TSH requires treatment. Context matters, symptoms matter, and lab trends matter. Let me know in the comments if you have had your thyroid labs checked. Let's talk about when thyroid labs are clinically recommended. Lab testing for thyroid is reasonable if weight loss is stalled unexpectedly, symptoms suggest thyroid dysfunction, there is family history of thyroid problems, there is an autoimmune condition or disease, and there was prior thyroid disease. Routine testing without symptoms isn't always needed, but baseline labs are often helpful in obesity medicine. Now let's talk about the elephant in the room, GLP-1 medications and thyroid cancer warning. GLP-1 medications carry a black box warning regarding medullary thyroid cancer. Important clarification is that this warning is based on small rodent studies. In humans, there is no strong evidence showing increased risk for medullary thyroid cancer. However, GLP-1 medications are contraindicated in patients with personal or family history of medullary thyroid cancer or MEN2 syndrome. This is the cluster of thyroid, parathyroid, and adrenal gland tumors. Both of these conditions are actually rare. However, it is very important that you review your personal and family history with your doctor prior to starting GLP-1 medications. Now, remember that thyroid doesn't work in isolation, and thyroid deficiency is linked to several other metabolic disease processes. Thyroid dysfunction is linked with high cholesterol, insulin resistance, metabolic syndrome, PCOS, and fatty liver disease. So, untreated thyroid dysfunction can compound metabolic issues. But here's the key, most weight loss stalls on GLP-1 medications are not primarily thyroid related. Weight loss stalls are more commonly due to metabolic adaptation, loss of lean mass, insulin resistance, cortisol elevation, inadequate protein, and sleep disruption. You can watch my last few videos on insulin resistance and cortisol if you would like to know more about these and how they can derail your weight loss journey. Let's talk about some myths. Myth is if I'm not losing weight, it must be my thyroid. Fact is, thyroid causes modest metabolic slowdown, not massive unexplained obesity in most cases. Another myth is normal TSH means my thyroid is perfect. Fact is, optimal range varies. Symptoms matter. So best to look at the whole picture. Another myth is GLP-1 medications damage the thyroid. While the fact is no strong human evidence supports this, however, caution is still recommended and you should be reviewing your personal and family history with your doctor prior to starting GLP-1 medications. Here are some questions to ask your doctor. Should we check my TSH and free T4? Do my symptoms suggest hypothyroidism or low thyroid state? Are my thyroid levels optimal for weight loss? Remember, normal doesn't always mean optimal. Should we evaluate thyroid antibodies? Could something else explain my stall? Have you ever had your thyroid labs checked during a weight loss stall? Let me know in the comments. Here is the big picture. If your weight loss stalled, it might be your thyroid, but it might not be. The key is structured evaluation with your doctor, not guessing and not self-blaming. Thyroid is one piece of the metabolic puzzle. It's the thermostat that sets your body burn rate, but it must work in harmony with your fuel, which is insulin, and your stress hormone cortisol to truly unlock weight loss. In my next video, I'll talk about high blood pressure, specifically why cutting salt isn't fixing your blood pressure. So subscribe and hit the notification bell so that you don't miss my upcoming videos. Please let me know in the comments what health topics you would like to learn more about. Understanding your biology replaces fear with clarity, empowers you to make informed decisions, and provides the foundation for true metabolic health. And informed patients make better decisions. Stay happy, healthy, and well. Bye for now.